Welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary anatomy and histology. Question number first. In ox, the distal extremity of the lateral malleolus articulate with options A. Tibia, options B. Tibial tarsal, option C. Fibular tarsal, options D. None. The right answer is options B, that is a tibial tarsal. In ox, the distal extremity of the lateral malleolus actually articulate with the tibial tarsals bone. Lateral malleolus is a small piece of bone which is located between proximal end of the tibial tarsals and the distal end of the fibular tarsals at their lateral aspect. And if we see that the tarsals bones are five in number in case of ox. In ox, there are five tarsals bones and one lateral malleolus bone is present. Okay, and this five tarsals bones are arranged in two rows. And the proximal row contain two bones, that is a tibial and fibular tarsals, while distal row contain three bones, that's a centrals and fourth fused tarsals, second and third fused tarsals, and first tarsals. Okay, in case of horse, it is six in number. That's a tibial and fibular tarsals, central tarsals, first and second fused tarsals, and third and fourth. Okay. In case of a dog, it is seven in number. Tibial tarsals, fibular tarsals, central tarsals, first, second, third, and fourth tarsals. Okay. In case of a pig, is also seven in number. Tibial tarsals, fibular tarsals, central tarsals, first, second, third, and fourth tarsals. In case of rabbit, it is six in number. Tibial tarsals, fibular tarsals, and the central tarsals, first, second, third tarsals, four tarsals absence in case of rabbit. In case of fowl, there's a no tarsals bone. Actually, the proximal row of that tarsals bone is fused with the tibia, forming the tibiotarsals, while the distal row of the tarsals bone is fused with the metatarsals, forming the that tarsometatarsals. Okay. Questions number second. Os angulaire is a name of which of the following? Options A, first phalanx. Options B, second phalanx. Option C, third phalanx. Options D, first and second phalanx. The right answer is option C, that is a third phalanx. Okay. Os angularis is a name of that third phalanx, which is a distal bones are also known as coffin bone, while os campidale, which is the name of that proximal phalanx or first phalanx. Os coronale, which is a name of middle phalanx or second phalanx. Questions number third. The interparietal bone are absent in options A, ox, options B, horse, option C, dog, options D, fowl. The right answer is option C, that is a dog. Okay. Interparietal bone is absent in case of dog. Actually, that interparietal bone is fused with occipital's bone before birth in case of dog. Okay. We already discussed the bone of that skulls, both that cranial bone and facial bones in previous video. Okay. Questions number four. The two part of the ligamentum nuchae are options A, anterior and posterior, options B, funicular and muscular, option C, both A and B, options D, funicular and lamellar. The right answer is options D, that is a funicular and lamellar part. The two part of that ligamentum nuchae are that funicular part and a lamellar part. Okay. At first, the supraspinous ligament is a very strong and long ligament, which is actually extend from that occipital bone to up to that the sacrum. It is very developed in case of a cattle due to their grazing habit by extending head toward ground and mainly composed of yellow elastic tissue. This supraspinous ligament is divided into two parts. That is a thoracolumbar part and there's a cervical part. Okay. Thoracolumbar part start from the sacral spine and is attached to that the summit point of that spine of the lumbar and thoracic vertebra, and it is proceed forward as a cervical part. Okay. The cervical part of supraspinous ligament is known as ligamentum nuchae. It has two components, that is a lamellar part and a funicular part. Okay. This funicular part extend from that the external occipital's protuberance in a form of rounded bundle, become a wide and flat and continue with the thoracolumbar part. Okay. The lamellar part is actually originate from that wide funicular part at a level of second or third thoracic vertebra. It's processed downward and forward in a radiating manner and divide into a cranial and a caudal portions. This cranial portion is thin and double, while the caudal portion is a single and single and thick, okay, and this cranial portions terminate at the spine of second, third, and fourth cervical vertebra, while caudal portion terminate at the spine of fifth, sixth, and seventh cervical vertebra. Questions number 5. In a in the fowl, the dash is the strongest bone of the soldier's girdle, and it's unite with the other two bone to form the foramina. Options A, that's choroid magnum. Options B, clavicle ovale. Option C, scapula and trioceums. Options D, coracoids and trioceum. The right answer is options D, that is the coracoid and trioceum. In fowl, among all three bone of the soldier girdle, that is scapula, coracoid, and scapula and clavicle, the coracoid is the strongest bone of the soldier's girdle, and it's unite with the other two bone, that is scapula and clavicle bone, to form the foramina, which is known as the foramina trioceum. Through this foramina, there's a tendon of the supra coracoidus muscles passes, which attach to the sternums and dorsal side of the humerus, and it helps to lifting the wings upward during a flight. Questions number 6. The spine of the scapula of dash divide the lateral surface of the scapula into two almost equal fossa. Options A, camel. Options B, horse. Option C, dog. Options D, ox. The right answer is option C, that is a dog. Okay. The spine of the scapula of dog divide the lateral surface of the scapula in almost two equal fossa, that is supraspinous fossa upper part and infraspinous fossa, that's the lower part. While the spine of the scapula of ox divide the lateral surface of scapula in a ratio of 1:3, while the spine of the scapula of pig divide the lateral surface in the ratio of 1:0.8. The spine of the scapula of horse is placed further backward. Okay. Questions number 7. The spur is present on the options A. The spur is present on the dash bone of the cock. That's male fowl. Options A, that is humerus. Options B, metacarpal. Option C, metatarsals. Options D, femur. The right answer is option C, that is a metatarsus. Okay. Spur is actually formed from the lower portion of the metatarsus bone on the feet or leg of the male chicken, most galliform birds. Okay, and it is mainly used in mating competitions or territory defense process. Questions number 8. The process of a bone formation is termed as ossification. It is of two types, namely dash and dash. Options A, cartilaginous and endocaloric. Options B, intramembranous and endochondral. Options C, both. Options D, none. The right answer is options B, that is the intramembranous and endochondral. Okay. The process of bone formation by deposition of a calcium in that fetal hyaline cartilage is termed as ossifications. We all know that all bones are developed from a mesenchymal tissue of embryo. It is of two types, namely that intramembranous and endochondral ossifications. In case of intramembranous ossifications, bone that develops directly from the embryonic mesenchymal tissue and usually occur in a deep layer of dermis, example crenula vault, mandibles, clavicles, etc. While in case of endochondral ossification, at first that cartilage is formed from that embryonic mesenchymal tissue, and this cartilage is further ossified by adding of that calcium to form the bone. Okay. Questions number 9. The most commonly used blood stain is options A, Leishman stains, options B, methylene stains, option C, xylene stains, options D, eosin stains. The right answer is options A, that is a Leishman stain. Okay. Leishman stain is the most commonly used stain for that blood staining. It is actually used to differentiate blood cells, like to differentiate RBC, WBC, and platelets, and also to identify that blood microbes, mainly that protozoa and bacteria. This Leishman stain is the actually modified version of the original Romanovsky stain. Okay, and this Leishman stain is a neutral stain. It contains eosin, which is an acidic dye, and methylene, which is a basic dye. Okay, eosin mainly stain that pink color, while methylene blue stains that blue color. Okay, bacteria is negatively charged and has affinity for methylene blue, so it appears blue on case of Leishman staining. Okay, And in case of a Leishman staining process, there's no need of a fixation of a blood smear, because that Leishman stains contain methanol, which act as a fixative agents which fixes a smear during the staining process. Okay. Questions number 10. The conjugate diameter is measured from the dash of the sacrum to the dash. Options A, spine and ischiums. Options B, spine and pubic symphysis. Option C, spine and ilium. Options D, none. The right answer is options B, that is spine and pubic symphysis. Okay. The conjugate diameter is measured from the spine of the sacrum to the pubic symphysis. If you see, that's the diameters of the pelvic inlet. There are four diameter of the pelvic inlet. First is antero-posterior diameters, which mainly includes, so there's a diagonal conjugates, true conjugates, and obstetric conjugates. And there's a transverse diameters, and there's a two oblique diameters. Okay. In case of that diagonal conjugate diameters, it is a distance between the lower border of that pubic symphysis to the midpoint of the sacral spines. Okay. This is the only diameter which is actually measures. Okay. True or anatomic conjugate diameter is that the distance between that upper margin of the pubic symphysis to the midpoint of the sacral spine, while obstetric diameter is the distance between midpoint of the inner surface of the pubic symphysis to the midpoint of the sacral spine. Okay. It's the shortest distance between spine and symphysis. Okay. uh, if we see that all three conjugate diameters, it is only the distance from measures from the spine of the sacrums to the pubic symphysis. Okay. In case of transverse diameters, it is a right angle to that obstructive conjugate diameters. Okay. While oblique diameter extend from that sacroiliac joint to the opposite iliopubic eminence. Okay. Questions number 11. The elbow joint is a dash type of joint which is comprised of lateral and medial ligament. Options A, ball and socket joint. Options B, gynglimus joint. Option C, both. Options D, none. The right answer is options B, that is gynglimus joint. Okay, elbow joint is a gynglimus, that is a hinge type of joint. Okay. If we see that on the basis of structures and the movement, joints are of following types. First is pivot joint. A pivot joint is a joint where a round bony process it fits into a bony group, and it's permitting rotations of the bone. For example, atlanto-axial joint, that is atlas and axial joint. Okay. Second is ball and socket joints. In this type of joint, a ball shaped bony head, which is actually fit into the concavity of that another bone, allowing a movement in several axes. For example, a shoulder joints and a hip joints. Okay. A plane or gliding joint, the joint surface of both bone are flat against each other, and gliding actions in one direction, uniaxials, can happen in this type of joint. Example is acromioclavicular joint, the joint which is between that acromion process of scapula to that clavicle joint, a clavicle bone. Okay. Hinge or gynglimus joint, a joint form like a door hinge, allowing only one direction's movement, uniaxial movement. Example of that hinge joint, that's elbow joint. Okay. Saddle type joints, there's opposing articular surface are both saddle shape. As a result, this type of joints can move in two direction, that is biaxials. Example of this saddle type joint is carpo metacarpal joint, that's a joint between carpal bone and metacarpal bone. Okay. And condyloid types joint, a rounded bony prominence of one bone articulate with a shallow indentations of another bone, allow two directions movement by axial movement, as well as circumductions. Example of this condyloid type of joint is metacarpo phalangeal joint, that's a metacarpals and phalangeal joints. Okay. Questions number 12. The muscles triceps brachii is a large three-headed muscles which consist of lateral, dash and dash heads. Okay. Option C, medial and long head. Options B, medial and small head. Option C, medial and oblique head. Options D, anterior and posterior head. The right answer is options A, that is medial and long head. Okay. uh, the muscles triceps brachii. Tri means three, ceps means head. Okay, triceps brachii is a large three-headed muscles which mainly consist of that lateral, medial, and long head. Okay, it's actually fill the angle formed by the scapula and humerus at the shoulder joint. Okay, If we see that's long head of the triceps muscles, it is a triangular and largest. It's mainly a sister to that extend the elbow joints. And the origin of this long head of triceps muscles is that caudal border of the scapula and a small portion of the same border of the humerus. An insertion process, this olecranon process of the ulna, and the blood supply to this long head of triceps brachii by deep brachials and posterior circumflex artery, and nerve supply is actually done by the branches of radial nerves. Similarly, in case of lateral head of triceps brachii, it is also triangular in shape and is actually lie just below to that long head of the triceps muscles. And the function is same of this triceps muscles to extend the elbow joint. Okay. And if we see that's origin, it is mainly origin from the cranial lateral border of the upper part of the shaft of the humerus and the caudal margin of the deltoid tuberosity, while insertion of all three that head of the triceps muscles is same, that is olecranon process of ulna, and blood supply and nerve supply also same. Okay. Similarly, in case of medial head of triceps muscles, it is a smallest among all three head of triceps muscles, and it is not in triangular in shape. Function is as like of same of that triceps muscles, which is that's to extends elbow joints. In case of VBC, that's origin. It is origin from that medial surface of shaft of that humerus at its upper third. Insertions, blood supply, and nerve supply is same as like of the other heads of triceps muscles. Okay. Another important muscle is that biceps brachii muscles, which is elongated spindle shaped muscles and located just in front of the humerus. And its main function is to flex the elbow joints. Okay. And its origin is that area behind the head of the humerus, and insertion that medial aspect of the proximal end of the radius and a proximal end of the ulna. Okay, blood supply done by the branches of a brachial artery, nerve supply done by musculocutaneous branch of brachial plexus. There is a note that brachial brachii muscles, biceps brachii muscles has bifurcated tendons of insertions. Okay, another important muscle is longissimus dorsi muscles, which is the longest muscles of the body and strongest muscles too. It extends from the sacrum up to the neck. Okay, it helps to extend the back and loin portions. If we see that's origin, it is mainly originate from tubercoccyx, iliac crest, and cranial surface of the ilium, supraspinous process of the sacrum, and lumbar and thoracic vertebra. And if we see that's insertion, it is mainly inserted that the articular and transverse process of the lumbar, thoracic, and cervical vertebra, and lateral surface of the ribs. If we see that's blood supply, it is done by lumbar, thoracic, and cervical artery. Nerve supply is actually done by branches of spinal nerves of concerned segment. Okay. Questions number 13. The alveolar border of mandible does not contain alveoli for canine teeth in options A, that's pig, options B, horse, option C, ox, options D, dog. The right answer is options C, that is ox. The alveolar border of a mandible does not contain alveoli for canine teeth in case of ox. Okay. The mandible actually form the skeleton of the lower jaw. It is mainly comprised of that body, and there's a two rami in which two half of this bone fused incompletely at that mandibular symphysis. Okay. If we see that's the alveolar border of this mandible, it's mainly contain 8 alveoli for incisor teeth, and there's a no alveoli for canine teeth in case of ox. While the alveolar border of the body of the mandible contains 6 alveoli for incisor teeth, two other alveoli for canine teeth in case of horse. In case of a dog, that alveolar border of a body of a mandible has 6 alveoli for incisor, 2 alveoli for canine, and 14 alveoli for premolar and molar teeth. Note that the mandible of the dog is characterized by the presence of angular process. Questions number 14. Isthmus faucium is the opening of dash into pharynx. Options say pharynx into thorax. Options B, buccal cavity into larynx. Option C, that is both A and B. Options D, buccal cavity into pharynx. The right answer is options D, that is the buccal cavity into pharynx. Okay. The opening of the buccal cavity into pharynx is known as isthmus faucium. Okay. Questions number 15. Lisa is a fusiform code which is present in the tongue of options A, horse, options B, dog, option C, ox, options D, pig. The right answer is options B, that is a dog. Okay. Lisa is a fusiform chord which is present in the tongue of dog. Okay. Lisa is actually a thick a fibromuscular cord which is situated along the middle of the ventral surface of the tip of the tongue. Okay, and if we see that's other fact related to tongue, that the apex of the tongue of a horse is actually spatula in shape. And there are two frenum linguae in the tongue of a pig. That's frenum linguae is a membranous membrane which helps to join the ventral surface of the tongue with that the lower floor of the jaw. Okay. Questions number 16. The corona glandis is present in the penis of options A pig, options B ox, option C dog, options D horse. The right answer is options that is a D, which is the horse. Okay. Corona glandis, that's at the base of the glans penis. There is a border which is known as corona glandis, is actually present in the penis of horse. Okay. Horse penis is, if we compare with other species, that is short and thicker. Okay. And in case of the dog, that os penis is present. In case of dog, okay, cranial part of the penis of a boar is actually twisted. Okay. Let's see some informations which is related to penis. Then the penis is actually a cylindrical copulatory structures. It mainly consists of three major parts. That's a root, which is begin at the ischial arc, body, which is that the largest part between the root and the glans, and there's a glans penis. Glans penis is the free conical end of the penis. Okay. And if we see that's muscles of the penis, then there's the ischiocavernosus muscles, bulbospongiosus muscles, retractor penis. Okay. And the blood supply to the penis, that is dorsal artery of the penis, supply blood to the penis. Nerve supply, that branch from pubic and from pelvic plexus, supply nerves to the penis. Okay. Questions number 17. Is dash is inward movement of a bone towards central axis. Options A, abduction. Options B, adduction. Option C, rotation. Options D, circumduction. The right answer is options B, that is adduction. Adduction is the inward movement of a bone towards central axis, while abduction is that outward movement of a bone away from the central axis, while circumduction is that movement in which that one end of the appendage remains stationary while the other end make a circular motion. Okay. Questions number 18. The cremaster internus muscles consist of dash fibers. Option C, striped. Options B, unstriped. Option C, both. Options D, none. The right answer is options B, that is the unstriped. Okay. The cremaster's internus muscles consist of unstriped fibers. Okay. The cremaster's muscles is actually the muscles that cover the testis and spermatic cord. Okay. And if we see that's origin of this cremaster's muscles, that is the internal obliquous muscles. Insertion of this cremaster's muscles is tunica vaginalis, and the artery, that's cremastrix artery, supply to this cremaster's muscles, and genital branch of genitofemoral nerve supply to this cremaster's muscles. And the main action of this cremaster muscle is to raise and lower the scrotums. Questions number 19. The anconeus muscles cover the dash fossa. Options A, deltoid. Options B, olecranon. Option C, obturator. Options D, none. The right answer is options B, that is the olecranon fossa. Okay. The anconeus muscles cover the olecranon fossa, is a small muscle which is located at the posterior aspect of the elbow joint attaching humerus and ulna. And if we see that's origin of this olecranon, this anconeus muscles, then it is a lateral epicondyle of the humerus. Insertion of this anconeus muscle is the lateral surface of the olecranon fossa of the ulna and a superior proximal part of the posterior ulna. And the deep brachial artery and recurrent interosseous artery supply to these anconeus muscles. Radial nerves, which is C5, C6, C7, C8, and T1, supply to these anconeus muscles. The major function of this anconeus muscles is that extension of this elbow joint. Questions number 20. Third trochanter is present in which of the following? Options A, ox. Options B, horse. Option C, dog. Options D, fowl. The right answer is options B, that is a horse. Okay. At the upper half of the lateral border of a femur of a horse, there is an extra prominence which is known as third trochanter. Okay. And if we see that supracondyloid fossa is also deeper in case of horse femur. Okay. While at a femur of a dog and rabbit, the supracondyloid fossa is absent. Okay. And at femur of the fowl, only greater trochanter is present. That lesser trochanter is absent in case of femur of fowl. Okay. Questions number 21. Among the cervical vertebrae, the foramen transversarium is absent in which of the following? Options A, seventh cervical vertebra. Options B, sixth cervical vertebra. Option C, fifth cervical vertebra. Or options D, fourth cervical vertebra. The right answer is options A, that is seventh cervical vertebra. Foramen transversarium is absent in seventh cervical vertebra. Cervical vertebra actually form the skeleton of the neck and is mainly characterized by there is a presence of short process and the foramen transversarium. The base of each transverse process of this the cervical vertebra is perforated by foramina transversarium. Okay. Questions number 22. Maxillary nerves passes through foramen. Options A, oval. Options B, magnum. Options C, both. Options D, orbitorundum. The right answer is options D. That is a orbitorundum. Okay. Which is also known as round foramen 2. Okay. The foramina orbitorundum is a circular hole which is located in the sphincter's bone of the skulls. It's mainly connect middle cranial fossa with that pterygopalatine fossa, and it's allow for the passage of the maxillary nerves, which is also a branch of trigeminal nerves. Okay, while foramina ovale is a foramen which is present in atrium septum, connect right atrium with that left atriums. And after the birth of the baby, that this foramen ovale get that closed. Okay, foramen magnum is the largest foramen of skulls. Is mainly present in occipital's bone, and it's allow the passes of the spinal cord, and it's the extension of the medulla oblongata. Okay. Questions number 23. The prostate has two parts in bull. One is the corpus and the other is the option C, pars disseminata. Options B, cavernosus. Option C, prepuce. Options D, isthmus. The right answer is options A, that is a pars disseminata. The prostate has two parts in bull. One is the corpus and the other is the pars disseminata. Okay. If we see that's the prostate gland, it's a fibromuscular gland which is situated at the neck of the bladder and at the beginning of the urethra. It is mainly composed of a glandular alveoli in that fibromuscular framework and is mainly covered by thick fibromuscular capsules from which that band arises, and this band enter into that gland proper in different directions to form the meshwork. Although it is said to have two lobes, but lobulations are not so much distinct in case of that the prostate gland. A number of prostatic duct that drain the secretion of this gland into the urethra on either side of the mucus fold at the roof behind the colliculus seminalis. Questions number 24. Renal pyramid are not distinct in options A, cat and dog, options B, horse, option C, both A and B, options D, ox and boar. The right answer is options B, that is a horse. Okay. Renal pyramid are not distinct in case of horse. Okay. If we see that the surface lobulations and number of a pyramid of kidney that varies from that animal to animal, the kidney of cattle and buffalo are distinctly lobulated, and the number ranges from that 18 to 22. And the number of a pyramid generally also same as to that's the number of the lobule. Okay. In case of human and pig, the surface lobulation is not distinct, but each kidney poses a multiple number of a pyramid. Okay. In case of a goat, a rabbit, dog, and cat, there is no surface lobulations, but the each kidney contain only one pyramid. Therefore, this kidney are called unipyramidals and have no calyx minor. Okay. In case of horse and sheep, there is a renal crest in place of pyramids. Okay. Questions number 25. The hyoid's bone articulate with which of the following? Options A, mandible. Options B, petrous temporal bone. Option C, occipital bone. Options D, none. The right answer is options B, that is petrous temporal bone. The hyoid bones actually articulate with petrous temporal bone. This hyoid's bone is located in the neck and can be palpated immediately above the thyroid cartilage and is suspended from the tip of the styloids process of the temporal bone by the stylohyoids ligament. Okay. And this hyoids bones give attachment to the variety of muscles and ligament that connect it to the cranium, mandible, tongue, larynx, pharynx, sternum, and soldier's girdle. Okay. Questions number 26. A plate of cartilage or dense fibrous tissue which is placed between articular cartilage and which divide the joint cavity is called as option C, marginal cartilage, options B, intervertebral disc, option C, menisci, option D, none. The right answer is option C, that is menisci. A plate of cartilage or dense fibrous tissue which is placed between articular cartilage and which divide the joint cavity is called as menisci. Okay, a meniscus is a piece of cartilage which is found where two bone meet joint space, and its major function is to protect and provide as a cushion the joint surface and a bony bone ends. Okay, questions number 27. The connective tissue fibers which show loose are gyrophilia when bundled are options A collagen fibers, options B reticular fibers, option C muscle fiber, options D elastic fiber. The right answer is options B, that's reticular fiber. Reticular fibers is actually type 3 collagen fibers, is a thin collagen fibers not typically detected with the routine that hematoxylins and eosin stains. However, these fibers stain black with that silver stains and often called that are gyrophilic fibers. Okay. Questions number 28. Malpighian's follicles are the characteristic histological features of options A lymph node, options B spleen, options C ovary, options D none. The right answer is options B, that is spleen. Okay. Malpighian's follicles are the characteristic histological features of spleen. Okay. The white pulp of the spleen is mainly comprised of that lymph-related nodules that is called Malpighian's corpuscles, which contain a peri-arteriolar lymphoid sheath, which is rich in T lymphocytes and macrophages, and also consists of marginal zone, which is rich in macrophages, and there's a lymphoid follicles, which is rich in B lymphocytes. Okay. Questions number 29. Hearing body are the structure which is found in options A, neurohypophysis, options B, liver, option C, thymus, options D, none. The right answer is options A, that is a neurohypophysis. Okay. Hearing body are the structures which is actually found in neurohypophysis, which is a posterior pituitary gland. Okay. It's represent the terminal end of the axon from the hypothalamus, and the hormone are temporarily stored in these locations. Both the neuro secretory hormone, that is ADH and oxytocin, are stored in this herring body. Okay. Questions number 30. Mammalian egg are which of the following? Options A, mesolecithal and isolecithal. Options B, megalecithal and isolecithal. Option C, microlecithal and isolecithal. Options D, medilecithals and telolecithal. The right answer is option C, that is a microlecithal and isolecithal. Okay. On the basis of amount of yolk, the egg are divided into four types, that is alecithal, microlecithal, mesolecithals, and megalecithal. Okay. In case of alecithal egg, where the amount of yolk is negligible, for example, human egg. In case of microlecithals, egg contain very less amount of yolk, that is an example of eutherian mammals eggs. Options that's third egg is mesolecithals, which is the egg contain moderate amount of yolk. Cytoplasm is equal to the amount of yolk. It is mainly that egg of amphibians. In case of megalecithals, amount of yolk is more than as compared to the cytoplasm. For example, bird, reptiles, and insect. Okay, similarly, eggs are also classified on the base of distribution of yolk, like isolecithals in the yolk cytoplasms. Yolk is evenly distributed. It's mainly found in alecithals and microlecithals egg. In case of talolacithals, there is an uneven distribution of yolk, either moderate talolacithals, where the one side of egg has cytoplasm while the other end is yolk, and discoidal talolacithals, where the egg where cytoplasm is in the form of discs, in case of that birds and amphibians. And last is centrolacithals in the peripheral cytoplasms. Egg is centrid. Okay, we can see that egg of insects. Okay, this much for today. Thank you.